Good afternoon, Rotarians, and welcome to our second online meeting. This is becoming more and more exciting, and I think we're all going to get better and better at technology as we continue this for whatever period of time we're going to have to do this. I got to say I miss the regular meetings and the fellowship, but I also like looking at your smiling faces and seeing names attached to it. So let's get the meeting underway. Heard the bell, and let's start off as normal with reflection from Chuck Mann, followed by the Pledge of Allegiance with Dennis Sherry. Chuck?
Loving God, we place into your care all of our doctors, nurses, and healthcare workers. Give them courage of heart and strength of mind and body. Keep them safe from harm. May they know our deep gratitude for all that they do to heal and help those affected by the coronavirus. God of all consolation, may they know your protection and peace. Bless them in these challenging days and bless their families. Amen.
This is the new one. Yeah. Okay. That just goes with that unit out front.
Thank you, Chuck. Dennis Sherry?
Yeah.
Yes, I'm on here.
Well,
And thank you. If we could all join in to read the pledge or recite the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you very much, Dennis. We have a meeting sponsor today. That's Raymond, and I saw that we had Brian Kennedy here. Normally I don't see him, but I don't see him on my screen. Brian, wherever you are out there in the world, thank you very much for that. We're changing up everything because there are so many changes going on, and trying to make this meeting go as smoothly as we can possibly do it. So we're going to start off by Kevin Mullen, who is going to introduce our speaker. Kevin?
President Tim, thank you very much. It is my privilege to introduce two guests today speaking to us about the important work that they're doing with United Way of Greater Toledo, one of which is not a stranger to our club. Jill Bunge just spoke just a couple of weeks ago with our club about the important work that 211 is doing, and we are seeing in real time how important that work really is in the wake of the coronavirus crisis and pandemic. And of course, we're also pleased to be joined by the President and CEO of United Way of Greater Toledo, Wendy Pestrue, who joined our community a couple of years ago. She did some schooling down in Columbus at Capital University, so not that other school in Columbus that we won't mention. But we're very appreciative to have her in Northwest Ohio leading us. So without further ado, I will hand it to Wendy Pestrue and Jill Bunge from United Way of Greater Toledo to talk about their response to coronavirus.
Thank you, Kevin, all for your time. And of course, thanks to Jill for joining me today. She's an outstanding professional, and I think will enlighten us as to especially where we are with food operations in our community. But I did want to go over some basic, just some information about where United Way is currently situated and what we hope to be able to offer the community. I'm going to go ahead and share a few slides with you, if that's okay. So, you know, we're looking at an organization that's over 100 years old. And if you think about it, United Way for over 100 years has faced the Depression, wars, I mean, a number of incidents where coming to community aid is a big part of what we do. We were just talking with Kevin about the water crisis a few years ago. So, you know, United Way is always there for folks, and we want folks to see it as, you know, the organization that's here for you to not only connect nonprofit organizations, but volunteers, corporate sector, individuals, different kinds of folks coalescing and trying to make an impact in community. Now, one of the things we're working very hard to do, and Jill will be speaking to this, you know, it has to do with collecting and assessing the needs with our 211 services and how we can impact lives with that connectivity. Obviously, like a lot of organizations, we are raising funds to address this particular crisis. We do have a fund that I'll discuss later in the slides that's for the emerging needs as we see them. And we see this coming in waves. We've been working in the space of feeding children recently, but we'll see many other needs present, and we want to be there for them financially. And then with this, be very transparent with how we spend our dollars, how we use our volunteers, and really help folks understand the role of United Way in this crisis and how it can be helpful to folks. So Jill, if you would tell us a little bit about where 211 is right now.
Thanks so much, Wendy. Appreciate that. So just as a quick recap, as many of you know, 211 is our 24/7 information and referral service that connects people to health and human services that they need. And people are able to access that by calling, texting, or online chatting with any of our community resource advisors who are providing them with information on food, shelter, financial counseling, legal assistance, job finding resources, and many, many more services that exist in our community, which of course, right now we're anticipating are only going to continue to increase. So I wanted to share a little bit of information to get folks up to speed on our 211 data since the COVID outbreak. We've actually created a marker in our database so that we're able to track all COVID-related calls, information about people's requests, and then the demographic information about the individuals who are calling for help. So just a couple quick definitions to begin. When an individual reaches out to United Way 211, that means a contact is offered. When they're actually able to get through and speak to a community resource advisor, that's counted as a contact handled. So sometimes people are contacting us and they either drop off, the call is, they're disconnecting the call prior to getting connected to a resource advisor, which we consider an abandoned call. So these stats are from the week of 3/15. We're actually waiting for our new week-by-week comparison stats of the week starting the 23rd. We'll have those by the end of the day today, and I'm happy to share those out. So right now will be week comparison of 3/8. That was our last normal week, so to speak. And then the week of 3/15, which was when we really saw things escalate. So in that time, there was a 143% increase in our contacts. A normal week for us, as evidenced by this slide, is about 1,300 contacts. The week of 3/15, we saw over 3,200 contacts into 211, and those numbers have remained stable. So our contacts, we have 23% of our contacts were abandoned before they were able to get to a community resource advisor. What we're trying to do now, and what we've done since the week of 3/15, is really increased our staffing to ensure that we have enough people on the line so that we're dropping that number down to our best practice. 15% or less are abandoned. And we've seen improvement over the past week in making sure that we have enough people answering to the call. Our highest call volume on 3/19 was 692 contacts to 211. On an average business day, we're receiving 250 calls. So the need has just really significantly increased. 33% of those contacts overall were COVID-related calls. And as I said, we're continuing to track that, who's calling about assistance related to COVID. And then the needs that we're seeing most frequently right now are revolving around food assistance and then explanations of unemployment benefits.
So as United Way works to take its 211 data and take the information from these callers and what's on the ground and going to the next level, we are also looking at our program data. We've had, over 15 years of data that's been examining our nonprofits in the community and how they influence the lives of folks, and then taking this new 211 information and how we can progress the discussion with all of this data makes a lot of sense. We also have collaborative partners I'm going to discuss in just a moment that will help us also with the data find. And then the city and the county have memorandums of understanding with the United Way. And basically we overlay this information and metrics to better understand our ecosystem. We are examining when these federal packages are delivered, who will get dollars from the government versus where philanthropic dollars need to be invested. And we do have at our organization a new data analytics research department. It is headed by a young woman named Devon Overton. She's also serving on the homelessness board. Devon is doctorally prepared in this space. She has a couple of other folks who are, as well as having an overarching board level committee that informs her as to data use and how to have the most impact on community with this data. So we're honored at United Way to be a repository of this information and then to share it with others. Last week, we started the first of what will be weekly corporate funder calls that includes the Community Foundation, the Chamber of Commerce, the city, the county, and the corporations in town who make investments in philanthropy, and to help guide them through the crisis so that they feel their investments will have the most impact with organizations who do good work and are affecting the lives of many folks right now. As I mentioned, our collaborative impact partners with the Healthy Lucas County group, obviously they are extremely busy. Their data and information share is critical to us now, as well as LMHA and understanding the housing environment in our community. As you know, LISC provides tremendous financial counseling services. And so these partners in this discussion are all feeding to us data and information. We are also having weekly meetings so we can learn a little bit about what they're finding in their spaces, what's happening to folks. For example, last week we learned a little more about the telecommuting power of the financial opportunity centers and how they're still able to help people transition if they lose a job and need information. Telecommuting even with LMHA and helping to ensure that residents have safe places and good shelter. The concern we have, and there's going to be a little research that's going to be shared later in the week, and we can share it with you as well, is with the daycares closing. You know, how is that affecting the child care space, but also, you know, all these preschool folks that have been working with the 0 to 5 age group? What does that look like on the horizon for the pre-kindergarten discussion that we've been having over the last couple of years? How will this impact that workforce? Also, we're in touch with hospitals, shelters, and other folks just to be certain that we are aware of the circumstances folks are facing and how we can be helpful in this. So our lead partners are a huge, huge component to our better understanding community need.
So one of our most immediate response efforts has been around making sure that food insecure children have enough to eat. We know that so many kids in our community are dependent upon free breakfast and lunch at school, and so that was one of the first places that we were mobilizing. We worked with both Toledo Public Schools and with Connecting Kids to Meals to make sure that we could help utilize 211 as a single point of entry to ensure that children could reserve meals and that parents and individuals knew where they could take students to receive those meals. That has been another really wonderful opportunity for us to engage our incredible volunteer network. Lots of folks are coming out of the woodwork and they want to help and be useful and make sure that they're taking care of themselves, their families, people around them. So we've been able to plug in quite a few folks. So TPS was able to create several distribution sites for meals, as well as Connecting Kids to Meals, which is another local organization here in Toledo that provides out-of-school meals in the summer for students through the summer meal program, which is funded through the USDA. So we were able to work with both of those entities to utilize 211 as a space where anyone can call in, get information about the 16 sites that exist throughout Toledo, where kids can come every single day, any child under 18, regardless of where they go to school, and get takeaway breakfast and a lunch same day. At the Connecting Kids to Meals sites, we were able to fundraise some dollars and utilize and leverage our partnerships to ensure that kids had snacks to take home on the weekend as well. So we've created and implemented this plan to deploy these volunteers to be able to do several kit builds. As of today, we have actually built 7,800 weekend snack kits that are going home with children on Fridays at the Connecting Kids to Meals sites, several of which are at local libraries and YMCAs in neighborhoods. They're in walking distance to folks. And so they're staffed by our volunteers, they're being handed out to students, and we're actually up to, that number in the presentation is a little under, we're up to 31,000 meal reservations that we've taken since March the 13th, which is when we opened up our 211 phone lines to ensure that students would be able to reserve meals at their particular site that was most convenient for them. So that's a space that we've really seen obviously a lot of need, and we've really been diligent to make sure that people can access food in their neighborhood for children. And then something that I think about, having worked in the food insecurity space for several years, and I think it's important to keep this in mind when we're thinking about COVID and our response. Prior to the COVID crisis, food insecurity was already a very deeply rooted issue in our community. 1 in 5 adults and 1 in 4 children are experiencing food insecurity on a given day. 80% of Toledo Public School students and 60% of Washington local school district students are eligible for free and reduced meals. And food resources are consistently in our top 3 most requested needs through 211. So our mobilization moving forward really revolves around accessibility to food for all populations. And as I said, 211 can be the single point of entry to be connected with food resources across the community. And we can really triage an entire family, right? So if students are able to get food at a meal site, we can make sure the grandmother in the household is connected to mobile meals or area office on aging to ensure that she's able to access food, what food pantries are nearby that the parents can access. We really want to make sure that everyone gets the food that they need. So as mentioned, 211 has been taking meal reservations for students. We've been updating the records of these meal sites as they have been changing and evolving. I know a lot of us are dealing with really rapid changes day to day in our worlds. Food pantries have been changing, so we really need to make sure that our database is the most up to date that it can possibly be so that we're providing accurate and up to date information for people. And a lot of new resources have emerged also since this outbreak, which is wonderful to see our community rallying around. So United Way is looking to community partners to really gather information on the gaps that exist at present. As I said, working with TPS, connecting kids to meals, because parents can't receive the meals at these meal sites. As I said, we're looking at how food pantries can outfit them, and just assessing capacity to see where we can direct resources to fill needs for folks who are ineligible or for overflow clients if resources are limited. And one of the top priorities in the emergency food space is protecting the most vulnerable individuals while ensuring that they have enough to eat. So seniors who should remain at home, immunocompromised individuals, individuals with medical dietary restrictions, those folks are really at high risk. So if a diabetic patient can't access food and needs emergency medical treatment for their diet-related disease, that trip to the emergency room puts additional burden on medical staff, and plus that puts them at risk of exposure. So we're really trying to think creatively about how we can fill in some of those gaps to ensure that everyone is safe and has access to food. And not only is United Way staff doing this information finding, but our 211 community resource advisors are also gathering really invaluable information from callers who are utilizing services or maybe experiencing service gaps in real time. So we're able to use this information to get a handle on the entire landscape and better inform the community about how we can provide better service for in the food insecurity space. And I really truly believe that there are enough food resources in this community to ensure that everybody has enough to eat. So our work has really been to be building strategy around filling gaps with philanthropic dollars, also keeping in mind the federal response to COVID, so that we can connect entities both in the nonprofit and the private sector to create some more effective distribution networks for food access.
Thank you, Jill. Jill's a tremendous professional, as I said, in this space. She's very creative and thoughtful, as well connected, and I think it will have a huge impact on how United Way and the programs that do offer food and that understanding. And it's an interesting thing because you get the feeling that this is maybe forcing us into a discussion that becomes a better long-range plan around food insecurity in our community and an opportunity for us to affect change in that space that's badly needed. So not just now, but always. So Jill, thank you so much for your commitment to this work. Wanted to talk a little bit about United Way's work with our elected officials. When I took the position a couple of years ago, it became a very high priority for us to, I think, have better communication. And as we built out our data research center, as we have enhanced our 211 services, all of this data is made available to our elected officials. We have conversations with them consistently, and especially now sending them weekly updates to let them know exactly how these populations are being affected and what the needs are in their constituencies as we see them from the perspective of the United Way, our collaborative partners, and our agencies. So we are in communication. We are tracking information, as I said earlier, especially working through a legislative tracking document that will help us understand where investments from the government will be and then where we need to be more proactive in the philanthropic side of the work, and looking too at how to grant out dollars and most impact possible based on this data, and then working with these partners. And we've been very appreciative as to how responsive the elected officials have been. They've been truly amazing. So a great experience with our electeds, and we appreciate the fact that we've been able to closely connect around this conversation in particular. Some projects that United Way is working through currently, as Jill mentioned, looking to community-wide coordination of food-related services. You know, as people start to go into quarantine and they can't leave their homes, you know, we're trying to be creative and think through folks who may have never had to look at themselves as food insecure before, but we may need to take a proactive stance and look at this very differently, because a lot of people are losing their jobs. What does summer foods program look like? You know, we've got a lot going on with school being out, so you can imagine there's quite a bit of work to do there. The other thing we got engaged with a couple of weeks ago, we were called about personal protective equipment. Our 211 data, their resource and the connectivity that they have to the agencies is helping us better understand, as far as the homelessness shelters, domestic violence centers, mental health care, places that take care of children. They need sanitizers, they need equipment and protective gear as well. So that being said, we've coordinated with Lucas County and are dashboarding the information and creating the data information space that they need to be more effective in prioritizing who gets these products when and how. Obviously, our hospitals, first responders, and frontline caregivers are the critical needs area, but then after that, we look at some other organizations and what they might hope to accomplish, and so it seems that we needed to be you're really helpful in this discussion, and it's been a great coordination. Also looking at extending financial counseling services. That's a work that we do with LISC already, but you know, what are the opportunities for us to be more supportive of these families as they try to navigate their unemployment benefits, when and how they will have to pay things back after this crisis, as far as food insecurity and budgeting. What all can we do to help them make good choices now, and then as this crisis you know, continues and or changes the landscape of the employment dynamic, we want to be on the ground and helping there. We are sending all of our data and information to the Emergency Management Office. That's a daily activity, and they in turn send things to us so that we can be more efficient in our work and community. And then our shared policy and advocacy services, as we have a great legislative person here who really studies the work, how can they offer that to our agencies, to our partners, so we all better understand how this is impacting the communities we serve. So sort of an overarching way to look at the United Way, and not just in this time of the, you know, with the COVID pandemic and in such a difficult space for our community, but what we want to be to community overall. And it really does start with on the ground, our 211 resources, the folks who call in, the agencies who take care of them. What can we learn from all of these folks that help us better understand where community need lies? Then taking that and putting it through a research and analytics lens. As I mentioned, we have a great team here. We also have overarching oversight, including the academic models here in town, to better understand this data and to coordinate it with other organizations. We share this data with our collaborative partners, and we are instituting a results-based accountability model, which is a methodology that helps people with strategic planning. As this crisis evolves, folks have turned in their COVID plans, sort of those temporary plans for their agencies and organizations. As they plan to take care of folks, how do we better understand and how can we create connectivity with those groups? And just better integrated support services overall. Now, then this information, if you think about, you know, we sort of gain a big snowball rolling around this circle, then how do we get that out to you all? And Rotary is a great example of a stakeholder in this discussion. This data, this information, the impact that we make when we do invest in our philanthropic resources, what does that look like for community? So after today, we would be happy to share with you a lot of the information we garner. We do a weekly 211 report that might be of interest to you after you heard Jill talk a little bit about the data, but it will break it out for you. There are things you'll understand around need from various zip codes, what people call in for, where the unmet needs are. And I think that's one of the things we learn the most from, and cycling through the data and cycling through our collaborative partners and helping us all understand, you know, where we can get better and stronger as a community. So hopefully all of this makes sense to you all. If you have questions or ideas, we look forward to sharing those and having an ongoing discussion with United Way is very important to all of us here, and that you have input and you see so many things in community as Rotarians that we may not identify right away. So we really appreciate that lens.
Wonderful, Wendy. Thank you so much for your presentation. Jill as well. At this time, if you guys have some time, can we go to our members for some questions?
Yes, absolutely.
Excellent. So again, a reminder for folks in the club, if you have a question, your microphone is muted, but we ask you to raise your hand and then we will call on you one at a time. And that's a digital raise of your hand. So you'll click on participants at the bottom of your screen. And then in the window on the right, I think is for most people, is where that will be. So we'll go to our first question right now is from Michelle Klinger. Michelle, go ahead.
Okay, thanks. I'm just interested in how many volunteers that you've been getting and what is your need for volunteers for food service. I ask this because Partners in Education is working remotely, and we're using some of our funding to be able to help out connecting kids to meals with their meal packaging. But we were wondering about the meal delivery services and handing out meals and where there might be needs in the volunteer space. We have over 200 volunteers that work with Partners in Education, and we may be able to drum up some support for those areas where there's particular need.
We appreciate the question, and we didn't want to go too long on this discussion, but we've had over 1,200 folks volunteer. We'll need many more. The food discussion will go on into the summer, and so we see ourselves as trying to make this work. For those who are interested in either volunteering or donating, going to our website, you can go ahead and register. There will be a pop-up for you to volunteer immediately, and the registration sites are available. I remind folks that this will evolve over time, the opportunity to volunteer and what that looks like. We are keeping in mind the social distancing when you do the meal kit build here at United Way, recognizing CDC guidelines with gloves and sanitizers, and then you're spread out into a lot of different rooms in United Way so that you don't have a lot of contact with somebody. But then we're also looking at the, meal kit drops and things where it's kind of that running over to, dropping it and leaving and again, keeping the distancing. But we also have on the United Way website a list of contact lists, volunteer opportunities, including, just teleconnecting with senior citizens and making sure that they don't feel isolated, opportunities to just call folks. And Area Office on Aging gave us some great ideas with that. Food pantries need help. We have an updated list of food pantries, the hours they're open. If you want to drop off groceries or something to those folks, that's appreciated. And then we have an emergency relief fund if you're interested in giving. Those funds are specific to the COVID crisis. And as we said, there will be waves of need. So it isn't just food related. We do see ourselves in our RFP process using the data that's exclusive to United Way through 211 and through our data research center, using that data to really guide strong investments in community. So if you are giving to that fund, I think you'll appreciate, as we talked a little bit about the data, and I know you've seen presentations previously on 211, you'll see that will be where the investment process really cycles. So volunteers and donating to United Way, we use that data very explicitly.
Thank you.
All right, wonderful. Thank you very much. All right, and then I'll go, Brent Cousineau has a question as well. Brent, you are unmuted. Go ahead. Maybe. All right, you're not unmuted. You guys are stuck with me for a minute. All right, there you go.
Thank you, Kevin. To Wendy and whoever might answer, I'm just thinking and looking at the Johns Hopkins data. And as of a couple minutes ago, the greater Detroit metro is at 4,500 cases. The whole state of Ohio is at 1,650. So just our neighbors to the north are in a very, very severe situation. Most of us have been following that on the media. And I think also, periodically I've been watching the governor's 2 o'clock briefing on the Ohio channel on YouTube. And he made the plea that we do not have sufficient supplies of PPE and a number, about 10 different items, woefully, do not have. And so hopefully everybody saw that. I guess if anybody has ideas, they made it clear that they want to hear from you. And it's easy to find how to get that word to this state. I think locally, though, is the way to try to see what we can do. I've been talking with the guy head of supply chain at the Mercy Health System for the Toledo region. They're very desperately searching for more product. I'm sure ProMedica is no different. So we have a real, I think we all know this, but I think it's a little bit more dicey than some of us want to understand. Doubling the bed count here, I know Mercy's already working on that very issue. So I don't know if there's a question there, but I'd be interested in any reactions, whether it's from Burwell or Wendy or whatever, in terms of, just this reality of what could come from the north to us and so forth.
And my husband is over the analytics for the University of Michigan Health System, so I'm living in real time with somebody who's watching that discussion. I've been sitting in on some town halls just trying to understand, even in Washtenaw County, what they're facing, and obviously their friends in Detroit.
Yes.
And it is, it is staggering and overwhelming, and it's something different because we wait for those reported numbers that come out through the government. But when you live with somebody and figuring out the bed situations, it's an anecdotal thing. But the University of Michigan had 2,200 nurses asked to be redeployed to frontline care as of Friday. We see people that are, I think, going to take heroic measures as professionals to try to make a difference. So how we do that in community, and to your point about finding the PPE and the donations and this discussion about organizations that have it available or can make more of it, I think it's obviously a pretty critical one.
The other factor that we're going to be facing, quite honestly, and talking to a CEO that's in the mix on this, is that the problem will not necessarily actually be the beds, it's going to be staffing. Yep. And we're going to run short on nurses. And so in Detroit, the Ascension system, for example, is repurposing their staff. PTs are doing data entry now, or going and being the gophers for the nurses. They get gowned up and they're the gophers for the nurses. So the amount of creativity necessary is amazing.
It is. That's a good point. Very good point.
Excellent, Brent. Thank you very much. All right, let me look. Jean Dries, I think you're the next one up. I may have unmuted you.
Can you hear me?
Yes, we can.
Okay, so thank you, and Wendy and Jill, thank you for the update. I am with Brightview in previously years with Harbor Behavioral, and I just wanted to make you aware, and I will send you the Zoom meeting information, but we have a heroin opiate task force meeting. There's about 6 of us on the panel tomorrow, including DART and the big providers, because again, we're trying to stay afloat and make sure everyone understands the loosening of the regulations. As an example, where I am, the telehealth, now we're doing clinical counseling via phone, and it's billable. So I will just send you that information, because we're living in a world where we are now very concerned about not the people so much that we've always cared for, the severely mentally ill, but the general effect on the population as this is happening in the mental health substance use disorder arena. So I just, as a courtesy, I will send you that. There's a call tomorrow led by the Lucas County Heroin Opiate Coalition. But yeah, we're all living it, but we're getting very, very, very creative, and we're getting the legislators to move on the regulations just to track down our patients and to try and keep them healthy. So just wanted to share that, and if you need any other information, I'm here.
Yeah, I think we'd, especially in the mental health arena, because we can't even imagine how this will affect people. I know that our organization personally being very worried about the domestic violence, incidents, and then obviously with addiction. Anyway, we really appreciate the information on that front. That would be very helpful and useful to us. Thank you.
All right. Again, a reminder, if you have a question, you can raise your hand, click on participants, and then there is a button there for you to raise your hand on your participant window. I'm attempting to get through these, and the good news is there's enough questions that I no longer know what order people are coming in. So Mark Arudia, we'll go to you next. Why don't you, maybe I've unmuted you, why don't you go ahead? Mark, are you still there? All right, maybe not. I feel like a bad radio host right now. Or caller on line 1. I think we lost the caller on line 1. All right, I saw Pat Bowe had a hand up, and he was next on my screen. Pat, it is not letting me mute and unmute here. All right, Pat, go ahead.
Can you hear us?
Yes, we can.
Oh, terrific. I just want to thank Wendy. Thanks for terrific. Raising our coaching campaign, 2020 campaign, and just Rotarians coming out a better time to get involved in the community by helping the United Way with this drive to help funding for, like we just said, find kids with meals and supporting the 211 to help everyone. So we're a very great community, and we're really blessed to be part of it. And in fact, also that my wife and daughter have been volunteering, packing meals, and let everyone know it's totally safe. It's a great environment. So thanks, Wendy, and hopefully we can all help a little bit.
We want to thank Pat. You know, Pat and Mary Louise have been amazing. Mary Louise has been volunteering at our sites. I want to say maybe, oh gosh, every day for a week now, or, you know, just, it's been amazing to see her here so much, and her daughter Justine, who's just delightful and home from school. So, and it's a real luxury to have leadership like this with your campaign and folks that really care about community at the level the Bows do. And the Andersons, you know, that's just a great organization. So we thank you so much. And can I, you know, they've had so many great ideas too, to look at how we work better together as a community, and we've got some fun things in the coming days to share. So thank you so much, Mary Louise and Pat, we really appreciate it.
All right, I'm gonna try and go back to Mark Arudia. Mark, it tells me that you are unmuted. Why don't you go ahead and try? Nope, I can't hear you. Hey, Mark, in the bottom of your screen, click next to your microphone and make sure you've got the right mic selected. It looks like you're wearing some headphones, and so it's possible that it might be using a different microphone than the one we've got.
Hey, Kevin, just as a side note to that, I actually saw that it was unmuted or earlier tried to mute. It's been doing some weird things on his account this whole time, so it may be.
Okay.
Let's move on to the next speaker.
Okay. Phil Marissy, why don't you go ahead?
Hi, everybody. Can you hear me?
Yes.
Good, good. I wanted to follow up on Jean Dries' question about mental health. Wendy or Jill, do you have any sort of feel for how the community is doing emotionally, either just here in the Toledo community or the state and nation in general? Has there been any discussion of the impact on people's mental health with this sort of being cooped up, very restricted? I don't know how to exactly put that.
And Jill, could you speak to the 211 statistically, some of the things you've seen come in that space, please?
You have to unmute, Jill.
Thanks. Appreciate it, Kevin. Yes, I mean, this is something that we've been tracking, and this is really the space where we get a lot of good feedback from our community resource advisors. They're folks who are talking to people in our community every single day, and I will definitely report back just subjectively because I'm having, you know, a morning briefing with our 211 director who is overseeing her staff every single morning. There's a lot of anxiety. People are scared. I think not only, you know, from a health standpoint and making sure that their families are taken care of, but what are some of those longer term things? We saw a huge influx in calls about response to unemployment when the governor made his announcement about the shelter in place and the applications for unemployment. So how do I navigate this process? Not only am I dealing with the intense mental burden, but perhaps I've never had to navigate applying for unemployment. So we're having folks calling in, just asking how to navigate those waters. We also saw a spike in calls when the stay-at-home order was put into place, with people not really understanding what that meant. There were a lot of misconceptions about whether or not they could leave their homes to go to a food pantry. And unfortunately, this is, you know, kind of our internal forecasting. I'm foreseeing this increasing as we're seeing more people contracting the illness, our hospitals becoming overburdened, or just responding to people who are in need of medical attention. You know, our 211 staffers are not in a medical realm. We do not attempt to give medical advice. We are really for making sure that people have access to the needs to take care of themselves and their families during hardship. So that's what we're monitoring right now. We, of course, do have wonderful referral processes for mental health agencies. And I think a lot of those folks are really being adaptable to make sure that people can access case managers, social workers. I know that I've heard around that people are starting to help train so that folks can do some coaching and assistance, like Wendy had mentioned, with just making sure we're touching base with folks and making sure that they have connectivity while folks are in isolation.
Do you have any sense of what people who are mandated to participate in group therapy are doing in cases like this? I'm maybe referring to people who are in treatment for opioid addiction and have to do daily 12-step meetings, things of that nature. Are programs like that still in place during this this lockdown?
Yeah, I've actually not, I've not followed up on that. I can do some investigating on that locally, but nationally, I've just heard some conversations and been listening to some different organizations who are trying to continue to do that from a telephony standpoint, doing virtual meetings like we're doing now, and really touching base. I heard it a lot around the AA space, people connecting with their sponsors and really trying to stay in touch. But I can imagine that's an incredible challenge. Would be curious to know what's going on locally, especially in the opioid space. So thank you for that resource sharing earlier too. We'll definitely sit on that Zoom meeting tomorrow.
Thank you for the info.
Absolutely.
Excellent, Phil. Thank you very much. All right, I want to be respectful of our guest time, and I know we're running tight on other things on the agenda. So I did see the question was typed in from Mark Arudia, and I did just get the note from Kathy to call for our final question. So we'll let Mark take that one. And I'll also just ask if you guys have a way for other folks to ask questions, if you could provide that information as well. That would be great. But Mark's question is, how do you find out if an organization on the 211 list of resources, and how does an organization get listed?
Oh, there you go, Jill.
My favorite speech. So you are welcome to log on to our 211nwo.org website. There you can search through our entire database. You can look up an agency directly by name, or you can look up resources by subject, like food, for instance. There's also a sign-in for providers, so folks can actually log on and either request new listing in the database. They can update their listing if any changes have been made. And you can contact our 211 director. I will provide my contact information directly to folks. You're welcome to contact me, and I will put you in touch with our 211 director and our database specialist. As I said, we're really trying to be diligent right now about not only getting new agencies into our database, but making sure that we have updates to changes in service or new and emerging programs that have come out since COVID. That's really important for us to be able to make sure that our community resource advisors are giving really up-to-date and real-time information to folks, as the nature of things has been changing so rapidly. So please reach out directly and we'll contact you and expedite that.
Excellent. Jill, Wendy, thank you very much, and I'll hand it back to President Tim.
Thank you, Kevin. Jill, Wendy, thank you so much for that very necessary conversation and presentation that you just made. Well done. I would normally offer you guys as a speaker a book and a gift and all that, but instead what I'll do is just say that we will make a contribution in your name to our Polio Plus fund, and we'll sort out the other stuff later. But you did a great job, and I appreciate it. As we move forward with the meeting, I have a few announcements that I'd like to make. One is, I'm sure that everybody, I hope everybody feels welcome in this meeting. We're finding it, I'm finding it given all the restrictions we have these days, I'm finding it a very helpful way to stay in touch with each other. The Zoom program, we've set it up in such a way, we've set it up, I really mean Travis and Kevin set this thing up, and they opened it up at 11:30, 11:45 to begin the tutorial process for those people that need it. I hope we'll continue doing that. But I also noticed that we have some pretty significant fellowship going on in that space before the meeting, and I'm very proud of that. I think we get a chance to know each other. You've all said that it's nice to see both the pictures and the names. You know, we're more than 400 members. It's hard for everybody to know each other. I'm looking at Lance right now, and if he'd smile, there he is, and we get to see each other. It's not all bad. Having said that, we've had at least 5 Zoom meetings with this club, not necessarily the overall meeting, this is our second one, but our committees and our executive board, and our board has been meeting this way, and I'm expecting that we will continue to do that. This is a tough time. We are scrambling to get things accomplished and to stay together as a community of Rotarians. It's a hard time for the world. It's a hard time for our country. It's a hard time for our community, and it's a hard time for Rotarians. We all know people that are shut in. Every one of us does. We all have connections throughout the community, and it's certainly true that some people are more shut in than others. And this is a good time to reach out to the people that you know are perhaps in trouble, having some problems. It's a scary time for everybody. We've had layoffs throughout the community. We've had businesses, hopefully they won't fail. Hopefully they'll all be back. But this is just shaking us to our core. At the very least, it's time to reach out to the people that we know and make connections with them. Just say hello. Just tell them you're thinking about them. It doesn't cost anything, and it's a necessary part of what being Rotarians is all about. To that end, I have, I was going to wear my, Travis, can you see this?
Now we can, right? A little higher.
If I put it higher, I can't see you guys.
There you go, perfect.
Okay, this is your opportunity for the next few seconds to write down my email address. And for anyone that didn't get it, my email address is imtryan@gmail.com. And the reason I'm making that so public is because we need ideas. You know, we've never done this before. We're kind of, I think we're doing a good job, but that's my view. If you have ideas of how we can be of assistance to the community, how we can be assistance to to our fellow Rotarians, I would really like to hear them, and that's why I've given you my email address. I don't know what you'll come up with, but I suspect it's going to be something interesting. Some people are doing some interesting stuff. You know, maybe this is the time in life to for people to explore new things that they want to do. Maybe it's the time to develop coffee chats or something on Zoom. I don't know what it would be. Maybe it's a time to make candlelight dinners for your family. It's things that Rotarians can do to stay connected, to let each other know what you're doing, and perhaps share those ideas. Let me hear what you've got going. I'll appreciate that. The next thing on the agenda is Kathy Tate is going to give us an update.
Thank you, President Tim and fellow Rotarians. My update is, in light of everything, is going to be brief and not urgent, but I published in the Spoke and on the email that you received this morning that our offices have been vacated at the Park End. The coronavirus is one issue, but the Park End has been purchased. It is officially closed as of tomorrow. I'm surprised it hasn't been in the news, and I wanted to let everyone know that before you did hear it on the news. So I don't have any other update other than the working remotely is working wonderfully between myself and Abby and with Zoom. The board and President Tim has appointed an ad hoc committee, a House ad hoc committee that's being chaired by Lynette Reichel. So they are on a mission to find our space, which again, we may not need before June, but I will keep you informed. And if you have any questions, again, there's rumors the Park Inn will not be opening again for probably at least a year as it goes under renovation in preparation for the Solheim Cup in 2021. So just wanted to make sure, I tried to get it out there as much as possible, and I wanted to make sure I mentioned it today on this Zoom call. So thank you very much.
Hey, President Tim, if I can jump in real quick. I know Bob Savage has an announcement, we'll say from the floor mic, from the program committee.
What's going on, Bob?
I have to unmute him first.
Okay.
All right, Bob, go ahead.
There we go. Not only could I not figure out how to put my hand up, I couldn't figure out how to unmute myself, but I didn't realize that I'm not the one to do that. We actually, just during this meeting, we have on the agenda next week, Senator Sherrod Brown, and we've been contacted in his office. He now has a 12:30 call every day to update on the virus situation. So they are asking if we could start the meeting next Monday 15 or 30 minutes ahead of time. So just while I know we're all reading lots of email, but I thought I would put out that request now, because this probably has the best chance of reaching people who will be on this call next Monday.
Does anybody object to us meeting at 11:30 next week?
All objections, say aye. These objections are all muted.
Well, perhaps you should let them raise their hands.
I think you can change the time of the meeting at any time, President Tim, as president. So
Executive decision, next week's meeting is going to start at 11:30 in the morning. We'll put something in the Spoke and get the information out to you as best we possibly can. Kathy, I think you should make yourself available for questions. You just made a pretty important statement about the Park Inn.
sure, absolutely. If anyone has any questions, happy to answer. I know very little, but everything is going to work out. But I'd say now with the new directive of April 30th, I may be in touch with you. I will need to pack up everything in the office that's still there, but probably not until early May. So I'll look for volunteers for that.
Okay. Well, I don't see anybody with their hands up for questions, so I'm going to move on. Brent Kuzno, would you come to the podium, please?
I am here, President Tim, and ready to go.
I understand you're introducing a new member.
Yes, sir. So can I roll?
Yes, please do.
Okay. So President Tim and my fellow Rotarians, it's a great pleasure to introduce new member Dennis Sherry. Dennis has the unique privilege of being our first new member introduced in our new virtual meeting format. I had the good fortune to meet Dennis about 9 years ago in my involvement with the Mercy Health Toledo Region Board. Dennis is currently an advisor to the healthcare industry, providing strategy, business planning, and project management services. Prior to launching this business, he was the regional vice president for strategy at Mercy Health, a position he held for the last 10 years of his 25 years there. In his role at Mercy Health, he directed all strategic and business planning for the Toledo region, and that included the 8 hospitals and over 7,500 employees. An extensive network of outpatient facilities are included with all the hospitals. Notable recent projects include investments that exceeded $200 million to develop new major campuses in Perrysburg and Sylvania, as well as developing key strategic affiliations. Dennis holds a master's in healthcare administration from the University of Minnesota and a bachelor's degree right up north from the University of Michigan. Recent board roles include the Ohio Living organization that's based in Columbus as chair of its board strategy committee. He also served as the board chairman of the Swan Creek Senior Living Campus here in Toledo. Also has served in the past on the board of the Regional Growth Partnership, the University of Toledo Edward Schmidt School of Professional Sales, and Big Brothers Big Sisters. Dennis is married and has 4 grown children, unfortunately none of whom live in Toledo. His hobbies include camping, astronomy, and woodworking. He and his wife Linda have been actively involved in AFS, American Field Service, and over the last 6 years, or actually over the years, they've hosted 6 international students. A fun fact is that Dennis and Linda are always all in on Halloween, decking out their home as a haunted house and passing out treats to over 400 kids. A little memorable note is when he dressed in a costume carrying the world on his shoulders, dressed like Atlas in Madison, Wisconsin, large paper mache glove on his shoulder, walking up and down State Street wearing a kilt and freezing his you-know-what off. His pet peeve is people who do not give a 100% follow through on assignments or commitments. And I can tell you, Dennis can be counted on for 100% of follow through. I've seen him in action. So please join me in a very warm virtual welcome to Rotarian Dennis Sherry. I can hear all the applause. Thank you. Thank you. And thank you, Dennis. And let me also just say one more word before I turn it back to Tim, which is, please, folks, do invite guests. You know, I'm on the membership committee with Shireen and many others. And today, Fred Truhaft is on as a guest. He wanted to hear Wendy Pestrue. And so, Fred, thank you for joining us. Tim, it's yours.
Thank you very much. Dennis, for the very first time in my life, I'm having a virtual welcome to the Toledo Rotary Club. If you were sitting next to the podium, I would hand this to you. I don't know if you can see me, but this happens to be our roster, and sooner or later, you're going to get one. The other thing that we'll do is provide you with a Rotary pin that will signify that you are a member in good standing in our club. And I'd like you to invite you to make a few short remarks and welcome. And we look forward to many years of getting to know you. So,
great, Tim, I really appreciate your remarks as well as Brent's kind introduction. It's great to be part of a wonderful organization. And when I joined, I knew it was a very sound, strong, adaptable, and robust organization. The fact that we're having these sessions through Zoom and keeping the comradeship and fellowship in place, plus the education and impact of the community, just great. So thank you so much. And I'm pleased to be part of this new organization.
Thank you and congratulations. With that, I'm sure that we have Chuck Mann out there. Chuck, are you there? Chuck.
Working on it, Tim. Sorry.
Hey.
He was there and then he just disappeared.
Yeah, he apparently dropped.
Oh, he left?
Okay, who's got a joke? Who's
None
got
that I can tell at mixed company.
It looks like Keith Burwell's got his hand up. Maybe he's got a joke for us.
All right, Keith.
Actually, I don't have a joke. I have a question, Tim. We're working, since we've been hearing all this today, we're working with the county to set up a place where first responders who must be quarantined can live. That is in place now. The bigger question is, how do we feed them? So I'm talking to area restaurants. We've raised some money. We're still raising some money to help feed them. If you are best friends with your favorite restaurant, you know the owner, please email me their name that we might talk to them, so we might work out a deal. Because we have, right now it's 5, we expect that number to go up, but we have to feed them 3 times a day because they're locked in a hotel and can't go out to get a meal, can't have their families come see them. But we're literally trying to feed them. And I wish I could tell you I know every restaurateur in town, but I don't. So I'm looking for help.
Okay. Is there an email that you want to put out where people can connect with you?
Yeah, I think everybody has it, but if you don't, it's keith@toledocf.org. About as easy as it gets.
Okay. What was that, Keith? At
ToledoCF, as in communityfoundation.org.
That's TOLEDO?
Correct.
CF?
Correct.
Dot?
ORG.
Okay. Okay. Sorry. Just,
no, that might be the biggest joke.
I think that's a good idea. I see a couple hands there. Are there jokes? Yuval?
A recommendation, actually. Dennis Prager University, Dennis Prager has a list of about 15 things to do while you are in quarantine. One of it is to support your local restaurants by ordering as many takeaways and delivery meals from the local restaurants.
Okay, could you send me a copy of that?
Of the list?
Yes.
Of the whole list, yeah, I will. But you can go into Dennis Prager University and upload it.
Okay, I think that's a good idea. I didn't think it was that funny, Yuval.
No, serious.
Matt Atkins, by the way, Matt, you've done some super work for this club. I see your hand is up.
Well, I actually have a couple of jokes if you'd like them, President Tim.
Okay, keep them clean.
What do you call a hen that counts her eggs?
I don't know.
A mathema-chicken.
Oh, God. Where is
And how do you make a candle happy?
How? How do you make a candle happy?
Just blow it out. It'll be delighted.
With that, hearing nothing else, and thank you, Matt. And don't quit your day job. We are adjourned.